Okay, we're only running a few minutes late. So our next speaker is Food Standards Agency and it's part of Lugtigheid. So please.
Thank you very much. Can everyone hear me okay? Mm-hmm. Okay, I want to start with an apology because lunch is quite close and I'm going to be talking about foodborne illness. So I hope this won't put you off your food later on. So I work for the Food Standards Agency and we are all about food. We work tirelessly to make sure that the food that you eat is safe and that you can trust your food. So you might know us from the food hygiene rating. Now if there's anything, just one thing that you take away from this talk, if you go out for dinner, always check the rating of the restaurant, because you never know. And we make sure that food is what it says it is. So if you have a beef lasagna, you know that it's actually beef and not horse meat. We also have an interest in foodborne illness, and in 2013 we started a project to see how we could use social media to predict foodborne illness outbreaks. So I'm going to be talking you through this. So we start with what norovirus is. How did we end up trying to predict outbreaks? What data do we have? How do we turn that into a prediction? So very simple. I'm not going to talk about much of the mathematics. What are we doing with our predictions and where do we go next? So norovirus is the most common cause of gastroenteritis. It affects about 1 to 3 million people each year. The most common symptoms are diarrhea and projectile vomiting for about 1 to 2 days. It's highly seasonal. Many of you might know norovirus as the winter vomiting bug, I believe. So it's more common in winter. It enters the food chain via sewage and shellfish, but it's also readily available, transferable through human contact. And there's no known cure, so people are not advised to go to a doctor, but instead just to stay at home and binge watch something on Netflix. It's highly contagious and it spreads very quickly in enclosed environments such as hospitals, prisons, care homes. And in 2002 I was misfortunate enough to be a crew member on this ship from Santander to Portsmouth, and 2 days into our journey somebody got norovirus and it spread very quickly and only 3 people weren't ill and I was one of those people, luckily, but it made our trip very, not very nice. We had to sleep on deck for 3 days because, below deck it's not very pleasant. Now to the serious bit, norovirus outbreaks cost the NHS an estimated £100 million a year, severely affecting health services. And just to illustrate, just in 2015 there were a recorded 490 outbreaks in hospitals and 465 ward closures. So you can imagine what that does to a hospital. It's not very nice. It costs a lot of money. So wouldn't it be cool if we could just predict outbreaks? This is what that would look like as an early warning tool. We have some sort of surveillance going on. We detect an outbreak. We stage an intervention. And then hopefully the outbreak is contained. I hope you can read that. And the question that we posed ourselves is, can we use social media data to do this? So I'm just going to sidestep for a second. Our project takes inspiration from Google Flu Trends. I don't know if everyone's heard of that, but essentially Google has correlated search terms about flu, symptoms of flu, with data that they get from the CDC, the Center of Disease Control in America. And they're trying to use these search terms to predict outbreaks of flu. And I believe the blue line here is Google's prediction, and the red line is the CDC. So you can see Works really nicely, apart from here at the end of it, when they shut down, I believe, when they highly overestimated the amount of cases. So this is really quite promising in a way. So can we do that with our data? Now, our version of the CDC is Public Health England, and they publish this norovirus and rotavirus report each week, I think. And this is the most recent one, and it includes a graph that shows you how many outbreaks or how many confirmed lab reports there were of norovirus. And if you just very quickly look at this, you can see that 2009 and 2010 was a particularly bad season. We're currently traversing this dotted line here, so we're pretty much okay so far, I guess. So if we want to know whether there's an outbreak, we could use this. But there's a problem with these data because this goes to week 41, which was October 10 to 16. So there's a delay of about 10 days, and that's after people have gone to their GP and the lab reports have come through. There's about 2 weeks. So we looked into using Twitter data to predict these rises in the lab reports. Twitter data, the nice thing about Twitter data is it's instantly available in real time through their API. There's a problem because you can't really access their historic data in large amounts. So to access these data, we use the Pulsar social data intelligence platform, which allows us not only to use the historic data, but also to use the real-time data. So it's what they call the full Twitter fire hose. We can track conversations between people, well, not private messages, and it gives raw data, so we can read every single tweet that we get out of it. But it also gives us aggregated figures of volumes. So there's a few considerations to take into account when you look at social media and illness. So the first question is, do people turn to social media when they're ill? Probably. People talk about quite a lot of things that you wouldn't expect. How do we know which tweets are relevant? There's lots of things that make people ill, as we'll see. And Twitter data also picks up on news reports, so news outlets will tweet reports, etc., and they might be included in this search. How do we know that there's a significant rise in lab reports, and how do we turn that into a prediction? And the sort of thought behind all of this is kind of keep it simple. We don't want to complicate things too much. So do people really tweet when they're sick? They really do. I feel like I'm going to throw up. So sleepy, feeling sick today. Stomach bug is killing me. Now, if we look at just a few keywords here, and they're given here below, and we look at the actual lab reports, and it doesn't take a mathematician to see that there's a high correlation between these two. And that's very encouraging. So in yellow it's the lab reports, and then in blue it's the tweets, the volume of tweets. So this is what we've essentially done. From lab reports we determine, and I'm going to tell you how we've done that. We determined the significant rise of the norovirus cases. We select a number of keywords that we search on in Twitter, and we did a crowdsourcing exercise through, well, I'm going to tell you later anyway. Then we use logistic regression to predict significant rises in lab reports from tweet volumes, and then if there were 3 successive rises, we stage an intervention. So the crowdsourcing of the keywords, we did that through our corporate social network Yammer, through Facebook and through the civil service fast stream. And the question we asked people was, think back to a time when you were really ill. How would you talk about this on social media? A lot of people on my Facebook said I wouldn't talk about it, but actually a lot of people do talk about it. These are the keywords that we came up with. We kind of see where this is going, right? We've got diarrhea, puke, sickness, bug, norovirus, feeling sick, vomit, etc., etc. But we've got a problem because there's a lot that make people sick. So, for example, real Donald Trump, why does your face look like you've had explosive diarrhea all your life? This is not an exception. We get quite a lot of these in this search. So we actually need to exclude some words as well. And these kind of fall into, broadly, they fall into a number of categories. One is, for example, pregnancy. It makes a lot of people very ill in the beginning. Drugs-related things. What else do we have? We've got Harry Styles. Since this was made, we've also included Trump, I believe, is in there somewhere. Yeah, so we have to include an anxiety related words like excited, nerves, interview, those kind of things. So these are the kind of criteria that we have for our search on Twitter. But of course language is fluid, so we need to iterate regularly to make sure that our keywords are still relevant. So for example, there's some regional geographic differences. In Southwest England, people talk about squids. In the USA, they talk about mudbutt, quite recent. And of course, there's lots of variations in spelling, because diarrhea is apparently such a hard word that nobody knows how to spell it. So we need to include all of those words in our search. So those are our keywords. We get lots of tweets using those keywords, but now we need to have a look at the actual predictions for lab reports. So what we're going to do is we predict weeks that will have significantly higher lab reports. And it's a very simple mechanism. We look at week by week change in the number of tweets, and then we look at the distribution of changes, and whatever week falls into the 75% quantile, we mark that as a significant rise. And you can see those marked here on the lab reports. So these are the predicted, not the predicted rises, they are the actual significant rises as they are in the lab reports. And then we use a binomial logistic regression model. We first clustered similar keywords together into groups using a PCA, for example, into categories like sickness, vomit, and diarrhea, because we have quite a lot of factors that go into that model, and this was a way of reducing that. And then we used past data on tweet volume and lab reports to train this logistic regression model to predict the increase in lab reports. We do that in 2 weeks' time, because the lab report has a lag. And we apply that to data that hasn't been seen yet. And this is what comes out. So again, the blue line is the lab reports, and then the yellow dots are the significant rise in reports, and the red dots are our predictions. It does all right. This is over a period from December 2011 to December 2014. Now, the model performs quite well in winter, but not so well in summer. Don't really care about the summertime because norovirus is highly seasonal, so we can ignore the positive results there. And then, important thing to note is that to reduce these false positives, we actually require 3 positives in a row before we actually start doing something. And from this, we get about 70% accuracy. And I would say that's quite good compared to having nothing at all that can actually predict it. So what do we do when we predict an outbreak? It's really quite simple. Through social media, we start reminding people to stay hydrated. for example, in this one. These are from NSS Choices. These are just kind of infographics that they put out there. To remind people to stay hydrated, take paracetamol, but also to stay at home, to make sure that they don't infect others, and to wash their hands after they've been to the toilet. This is not, I believe this is not the only intervention that we do, is it? We also look at single tweets, is that right? We look at single tweets to see if people are about to do something stupid, and we respond to that. I don't know what stupid in this sense means, but I know that we have a social media team that actually reviews these tweets on a daily basis and tweets to people when they're going to do something stupid. And then hopefully that will reduce our outbreak, these interventions. So that's what we've done so far. Just to give you an indication what has happened since. This has been running since we started it, and we've successfully predicted that there was not going to be an outbreak last year. So yeah, that's pretty good. But this year it's probably going to be put to the test quite a lot, because there's now 3 strains of norovirus that are going round, and so we might see a large increase. I'm just going to quickly talk you through what we think we can do next with this. There's some challenges using social media. So symptoms of norovirus overlap with other foodborne illnesses like E. coli, salmonella. Twitter's signal to noise ratio is quite low. Even though we exclude words, there are still a lot of things that we don't pick up on that make people ill. Less than about 0.5% of tweets is now geotagged. So they changed that in Twitter so that you actually have to opt in to be geotagged. So we can't really pinpoint where it is. But luckily the Pulsar platforms allows us better localization of the tweets through IP addresses and some of the metadata that they collect. Twitter messages are restricted to 140 characters. Obviously you can tell people that you're ill and have diarrhea in 140 characters, but people might be a bit more descriptive. And how do we deal with sarcasm and emoji? We were at a meeting at Twitter not too long ago, and actually the consensus was that you don't deal with it, you just kind of ignore it, because you can't really pick up on that kind of thing. So here's some solutions. One of the things that we're thinking about is to use some more advanced techniques, so support vector machines, some natural language processing, to classify the raw tweets and to look at what is actually relevant. But instead of using Twitter, we're also looking to use Facebook. People might be more descriptive, and we might be able to actually see how long people are ill for, but also to distinguish between different illnesses. That's what I'm showing here, I guess. So this is a kind of a decision chart of symptoms and likely diagnosis. So we can actually tell apart these different foodborne illnesses. Every single one of them includes diarrhea. If it's acute and bloody and watery, it's E. coli. If it's not, well, you get the point. I won't go through it. But there might be some way to distinguish these illnesses in social media about how people talk about these things. Of course, there is the risk that people only really talk about this one, and we can't really distinguish between any of them. But we don't know. We're going to look at that next. And extending the Holy Grail, this is something they do in France. I think this is quite neat. This is data from the Sentinel program. This kind of tells you what the change of cases of flu are in France over a period of time. I wanted to make an animation, but I didn't have time. But you can see the change in cases, and you know, if we can, then this would be a pretty cool way of doing things. Right. So to summarize, we've shown that Twitter data can predict significant fortnightly rises in the public health lab reports. And this surveillance tool can then be used to stage interventions and hopefully to reduce the outbreak. There are some challenges in using Twitter data for this work, but they're pretty much inherent to working with all social media. For example, in the case of sarcasm. And another example is, of course, that people start to use images quite a lot, or GIFs in the way they talk about things. We're just starting to use Facebook data as an alternative. There's a pilot running at the moment that we're just starting with Pulsar. And we're looking to distinguish between different illnesses. And I think that's it. Yeah. Thank you.
It's not exactly a question, but it seems like you're a victim of a possibly strong confounding effect here, because the point of your predictions is to stage an intervention. If your intervention is successful, then your prediction's invalidated.
That's a risk. Yeah. You want to talk?
It's a kind of success measure as well, really. So
yeah, the more wrong you are, the more successful you are.
This is Sean Thomas, by the way. This is my colleague from SA. Sorry.
Can't go wrong then, can you?
No.
Like or not. Any more questions?
Do you see any limitations in those data sources? I'm aware that Twitter it's a loss-making business in decline, and Facebook is locking down things more and more, and you can access this API, but your remit is UK-based. I'm aware there's emerging social networks everywhere. Russia be able to contact and this sort of thing. Maybe that extends beyond the data that you need to be looking at. Are you looking at things that are coming into the UK, maybe as not just based in the UK? I mean, so the question is really about future data sources as well.
I don't think we've really talked about that yet, about future data sources. But these are the data that we can access quite easily. But it's definitely there's some scope to check other sources of data. I know that in the beginning, when this was we tried this was using Google search as well, but that wasn't as successful. So we have looked at other sources, but yeah, good point.
You brought us back to time again, even
I know.
my poor chairing
It's good,
ability
isn't it?
has running over. Any more questions? Well, we're going to be here later as well, so let's thank Arthur again.